Hey everybody, welcome back to another Before the Pause, where we talk about things that no one really prepares you for in regards to menopause and perimenopause. Usually I share a lot about what I'm personally going through and what I'm experiencing in real time, but today I wanted to try something just a little bit different. Frozen shoulder is something that we get asked about all the time at Ortho Laser, and honestly, I keep seeing it everywhere on social media or in conversations. People just trying to figure out what it is, what's happening, and what can I do about it. So I wanted to take these questions straight to Dr. Press at Nova Orthopedics to get some real answers from an expert. Here's what he had to say.
Hi, I'm Dr. Cyrus Press. I'm an orthopedic surgeon who specializes in shoulder and elbow disorders. Frozen shoulder, otherwise known as adhesive capsulitis, is a condition where the ligaments of the shoulder become inflamed, painful, and shortened. As a result, that decreases motion globally so that people aren't able to move their shoulder normally. The most common difference between rotator cuff injuries or tears and frozen shoulder is passive motion. If someone else can move the shoulder for you, then we know that there's still motion in the shoulder that exists. So that would not be related to adhesive capsulitis or frozen shoulder. If I can't move the shoulder and you can't move the shoulder, that's true stiffness, and that's the main difference between the two conditions. This is a condition that I'm seeing very frequently, and I've been seeing it throughout my career, and it's something that we're still just beginning to understand. We do know that hormonal changes in people's bodies can increase the risk of getting this condition. That's why it is very common that women in their late 40s to late 50s are commonly seeing in my office for this condition. We know that there are other factors like diabetes and thyroid issues that can also play a role, but the hormonal issues are still being explored to understand better why patients are getting this condition at this time. The biggest early warning sign is pain that is out of proportion with an injury that they thought that they sustained. So one of the most common things that I see is a patient states that they did something that they didn't think much about and was having increasing pain in the shoulder. And over the next few days, they noticed that they were having difficulty reaching behind their back or pulling a comforter over on their bed or reaching for something behind them in their car. Those types of symptoms and signs, when there was not a particular injury, are often a concerning sign for early adhesive capsulitis. And we sometimes want those patients to be evaluated sooner rather than later to prevent problems in the future. The biggest piece of advice I give patients who are having any shoulder pain during this period of time in their life is to avoid aggressive stretching. A lot of times people are told no pain, no gain. Try to move the shoulder as much as you can or try to grin and bear through some of that discomfort. That's the opposite of what you want to do in this condition. The more you try to inflame the shoulder, the more the shoulder will fight back and will make the process longer. It's not uncommon for patients to be dealing with this condition for 9 months or even up to a year. So the more you inflame the shoulder by trying to work through it, the longer the process can take. Early treatment is important because it lessens the duration of the symptoms. Once somebody is diagnosed with adhesive capsulitis, it's going to go through a series of stages, and those stages are something we can't change. What we can try to change is the length of each of those segments, and we can limit those segments by trying to treat earlier, by getting the inflammation down quicker so that the capsulitis doesn't set in more fully and drag the process out longer. So I've been referring patients with adhesive capsulitis for MLS laser treatment for two primary reasons. One is it helps decrease inflammation, and two, it helps improve circulation. Those two treatments alone can help decrease the duration of time that patients are suffering with this condition. That, performed in conjunction with gentle, skilled physical therapy or anti-inflammatory medications, all can play a role in helping patients get back to normal shoulder function.
Dr. Press did such a great job explaining and breaking down what frozen shoulder is. It made it easy to understand. One thing we see every day at Ortho Laser is how much frozen shoulder improves when we focus on reducing that inflammation and improving the circulation. That's exactly what MLS laser therapy is designed to do. It calms the inflammation, increases the blood flow to the joint, and it supports the body's own natural healing process, especially during these painful and stiff stages. If you're dealing with shoulder pain, stiffness, or something that just does not feel right, don't ignore it. Early treatment can really make a huge difference. You know your body and you know what doesn't feel normal. You are your biggest advocate. And if you're going through perimenopause and you're noticing changes in your body, you're not alone. That's exactly why I created this series. Let me know what you're feeling, what questions you have. We'd love to answer them, and I can cover those next. Thank you.